state's coronavirus situation has been steadily improving for weeks, but that doesn't mean it's over. We're joined now by Dr. Daniel Koritskis, Chief of the Division of Infectious Diseases at Brigham and Women's Hospital. Good to see you once again. Today is the first of 2 days where the state is offering free tests at 50 pop-up sites in Massachusetts. Do you expect to see more positive test results from people who may have attended demonstrations over the last few weeks?
Well, good afternoon, Emily. It's good to be back with you. You know, it's really hard to say. I think most of the protests that I've seen, people have been really quite respectful about keeping distance where they can and wearing masks, and that could prevent any real transmission from occurring at the protests. I'd be more concerned about people who may have been exposed to tear gas or pepper spray that would have caused them to have tearing, or if somebody ended up being arrested and placed in a jail cell with other people, that might lead to transmissions. But for the people who are outdoors, I'm not so certain we're going to see more infections there.
All right, good to know. We've been looking at the info from the Mass Department of Public Health, talking about where coronavirus cases are now. So Suffolk, Middlesex, Essex counties, that's where most of them are. Far fewer in the Berkshires, the Cape, and the Islands. Do you think that could change as the summer vacation season starts? And what could that mean for hospitals in those areas?
Well, it certainly could change. You know, very early on, there was actually an increased number of cases out in the Berkshires, and I thought at the time it was likely that those represented people traveling up to the Berkshires from New York State, or New York City particularly. And then that died out. So now that summer is upon us and the travel season may begin, I think the hospitals there will clearly need to be prepared to care for people with COVID-19 if indeed we start seeing cases coming up in those regions from people traveling from other states especially.
You know, speaking of travel, we know that 21 other states are now seeing increases in new cases. So we're talking Florida, Texas, Arizona, they're all setting these daily records. If someone has travel planned to any of those states this summer, really anywhere, would you cancel them? Would you wait? When do you think it's safe for people to vacation outside of Massachusetts?
I would not travel to a state that is seeing an increase in coronavirus cases if it was simply for vacation. I think if you had to travel for a family emergency or urgent business, you could do so cautiously, always being careful to wear a mask and wash your hands. But I really am concerned about the potential for reintroducing coronavirus back into Massachusetts from people traveling to those states that are not doing as good a job at controlling the virus.
When we look at the global picture, and we see that the U.S. has higher numbers of cases. Is that perhaps because we have more testing, or there's more community spread happening here?
I think it's really because of more spread of the virus. If it were simply due to more testing, what we would see is that the percentage of tests that were positive would go down. We're doing more and more tests, most are negative, and only a few remain positive. And that's not at all what's being observed in those states where the number of tests or positives are increasing. And more importantly, the number of hospitalizations are increasing. So that's a clear indication that there's much more disease, not just people being positive because they're getting tested.
Really important distinction. Okay, Dr. Koritskis, thank you as always for your insight. We appreciate it.
Always happy to do so.